Hi, I'm Bob Schrupp, physical therapist,
And I'm Brad Heineck, physical
and
therapist.
together we are the most famous physical therapists on the internet.
Absolutely, in our opinion, of course,
Right,
Bob.
Brad, and when we make promises, we stick to them and we always keep them. So
Yep.
today we're going to talk about how to adjust a platform wheeled walker. We just showed you some of the things we like about it, what kind of patients you want to work with it. If you want to watch that video, I'll put it right up here. But let's go ahead and bring the walker in, Brad.
Yeah, well, it was a long string-on sentence, Bob.
Yeah,
You're getting
come
better.
on.
You're doing much better.
All right, here's the platform walker. There's actually quite a few adjustments you can do to it. The height of the walker, you can actually set that, but what's more important is where the platform's going to end up.
Right.
So Brad, why don't you show one that's not adjusted right as far as height,
Right.
and one that is adjusted right.
Okay, so obviously we have these adjusted at different heights. That is, you will never find anybody that will use this. I shouldn't say never, but I can't imagine a case where someone has this kind of discrepancy. So we're gonna look at this one. If you're standing up with good posture and you bend your elbow at 90 degrees, this is the gap there. And my forearm is gonna end up resting on here.
So he says 90 degrees, he means a right angle.
Right.
This is a right angle.
Yep.
Okay.
And so obviously if I was gonna go on this, we'll take the Velcro strap off so we're doing it right. That's where the forearm, that's the platform, that's where it gets its name.
And we don't want him leaning over this far.
Right, that's just a problem that waiting to happen for your back. So what you do is if there's just some thumb screws typically on there, there's different types. These are pretty common. You loosen these up. It's probably going to take two people if you want
These
to
are
do it.
very pain.
Yeah, because you loosen them up, the clamps get loose, this falls down. It's
These fall apart.
Yeah.
and-
Two people do it much easier.
Yes.
So what we did on this side, we did that off the video so we didn't have to put up with our
swearing.
Yep. So we raised it up, and now if you look at this, here's the platform, and if I bend my elbow to that 90 degree or right angle, right there it is. Now when I lean, I just lean a little bit and I bear the weight through my shoulder and not through the forearm and wrist. Okay,
Now,
Bob.
the other thing is, how far out is this going to telescope?
Right.
What you really like to have, basically, once you put your arm back on there, Brad, a lot of times what I like to see is that this maybe even moves back a little further, Brad.
Yep.
So right at the elbow is actually not even taking weight, because you have the ulnar nerve going through there.
Sure.
And you don't want to take pressure on that, so just maybe an inch or two of the elbow is off the platform here,
Right.
off the area surface of contact.
Right, and then the thing that you have is there's actually two more adjustments we have to do, and this is one of them. There's some screws right under here, two thumb screws typically, and then this loosens up, and you can pull this forward
Or back.
or way back. Obviously, that's too short. You want to get it so that position Bob was mentioned, elbow back there, and it's a comfortable grip there. And while you're there, you're going to do another adjustment and tip this in to a comfortable range. Some people may have it down here, typically not this way,
No, it's not natural.
but it's in there, you know,
Yeah.
unless there's some kind of anomaly, but right there. And also you have
You can
this.
turn it like that, and I have found that to be a very important one, Brad.
Right.
If it's most people, especially when I'm working with young therapists, they have it out like this and like this.
Yeah.
And the patient just can't, they just have trouble leaning on it like they should, but when they go like this, it's real comfortable for them,
Yeah.
and they perform much better.
That would be
So,
ergonomics.
Yeah, turn it in and tilt it in,
Right.
and you're just gonna find it out, it's gonna be a lot more comfortable for them
Right.
when they're walking.
And the other thing is the adjustments at that point, don't forget about, you can just raise the whole walker up and down by your standard adjustments down on the telescoping.
Good point,
legs.
yeah, if this is set and you don't wanna deal with, moving those, you can, once that is up there, you can actually, move the legs up and down.
Sure, so don't forget that option. So once again, if you're interested in finding more helpful hits on this equipment, we are not professional actors, but we are professional therapists, and we're gonna give you information and good information.
That's right, please subscribe.
Does that sound like a good sales pitch, Bob?
Yeah,
Did I do good?
You're a good salesman,
Ah, right.
amazing.